What's up, guys? Welcome to another episode of the Medicopolis podcast, where two teenagers discuss medical dilemmas and police them to reach an ultimatum on whether the situation is ethical or not. Thank you so much for taking the time out of your day to listen, and we hope you enjoy our episode on the ethics of the cost of healthcare. So, what is healthcare? Healthcare is basically the improvement of health by the prevention, diagnosis, treatment, and many other methods to the problems that people face in terms of their medical conditions or scenarios that they, have at the time. And it's covered by a variety of different professions that many medical professionals choose to, go down, such as dentistry, pharmacy, nursing, audiology, and so many other professions. And with healthcare, there comes healthcare systems, which are organizations that are established to meet the health needs of different targeted populations across the territory that the system is designed to cover. And a well-functioning healthcare system requires a financing mechanism, a well-trained and adequately paid workforce, and reliable information on what and who makes policies, essentially, and so many other factors that cause the healthcare system to be able to help their citizens as well as medical professionals who act under that system.
So, healthcare obviously affects our everyday lives, and just like our everyday lives, it costs money. So, how is the cost of healthcare calculated? Healthcare costs are calculated by a variety of factors, but the main ones are including your state of residence, your yearly household income, which includes if you have a spouse, their job, also maybe if you have another person living in your house over the age of 21. That income is also included. The number of people in your family depends, which includes the number of adults and the number of children. So that all in turn affects who enrolls in the marketplace coverage, which is a service that helps people shop for and enroll in health insurance, which the federal government operates. And then all of those factors together sort of mush together in order to figure out what your healthcare bracket is going to be. Essentially, how much are you paying depending on these factors all colliding together. And unfortunately, families in poverty might not be able to afford healthcare based off of these factors that calculate how much you're paying. So, in the case, there are different poverty brackets that, depending on the percentage essentially of your household size and other factors, will depend on how much the government will help pay for whatever's happening, whatever situation is occurring, so that you can get the healthcare you need no matter what type of financial situation you are in. And unfortunately, about 100 million people in the US are pushed into extreme poverty each year because of out of pocket spending. So, this kind of system, like Medicaid and stuff, really is helpful for these families who are in poverty who need these services essentially to live. Healthcare is really important for any American. So, it's a good thing we have these sorts of defenses or some sort of fail safes in place. But obviously any system isn't without problems, and there are many problems with healthcare in the US.
I mean, one of the huge problems is that many U.S. adults have difficulty affording various healthcare and dental costs and other healthcare services that really help them out. Fact for you, more than 65% of adults report paying for various aspects of healthcare, and it really negatively affected them and their well-being. And also, with these economic problems, there are additionally problems with how it might affect one race more than another, and this has proven to be true. Where another fact is that high healthcare costs disproportionately affect uninsured adults, which have tended to be Black and Hispanic adults and those with lower incomes. And this is a huge problem that needs to be solved. And Ashwin and I will get a little bit more into this later. And these are some of the problems that people in the US might face, racial and economic problems. But there are other situations in terms of healthcare systems that other countries have because they might set up their healthcare systems differently.
And that sort of brings us into our next topic of healthcare in the US versus healthcare in other countries. So, the United States is the only industrialized country in the world that does not have UHC, which is universal health coverage, for all citizens. While the Affordable Care Act was a step in the right direction of universal coverage, as of the end of 2016, 9% of all Americans still did not have health insurance, which means that while the Affordable Care Act, again, is the step in the right direction, it's not doing as much as we hoped, and it's not helping as many Americans as we thought it would. Canada and Taiwan, the only two countries that actually use this system, have adopted a single payer healthcare system. A single payer healthcare system is considered one of the best ways of achieving universal healthcare, but again, only two countries have used this practice, and also there are obviously going to be flaws with any healthcare system. For a single payer system, the government covers the medical care and restricts outside payments for the service it covers. Again, Canada and Taiwan are the only two countries that actually do this, but for America, it'd be something like standard Medicare, which is a little different because it's direct payments to whoever you're essentially to whatever hospital or whatever service is being provided to help treat you. Versus in Canada and Taiwan, it's already covered, but it comes out of tax anyway. So essentially, if two Americans got a heart transplant, they'd be paying more than essentially if a Canadian did, because a Canadian is already paying taxes into their healthcare system, which then the government covers for whatever service it provides. It's important to note, though, that the single payer healthcare system does not cover all sorts of treatments. So, if essentially you still might be paying out of pocket for certain things, but it's not as much as in America, where you're paying out of pocket or through an insurer for most, if not all sorts of treatment. There's also socialized medicine, which, again, just like a single payer system, isn't the only option for achieving UHC, but it's a pretty decent way. In socialized medicine, in addition to paying for healthcare, the government also owns the facilities and employs the professionals in a socialized medicine system. Canada and Taiwan don't have facilitated hospitals or paid professionals employed by the government. Essentially, the government owns all of the systems and provided with healthcare, and it's all paid for by the citizens through taxes, so they don't have to pay out of pocket or through their insurers. There's also insurance mandates, where the government mandates that all citizens purchase health insurance from a private or public insurer, which is sort of like America's, but with America, there's also government step in. It often requires minimum coverage, and there's subsidies for low income homes, so you don't have to worry about not being able to um, afford insurance, although there are obviously going to be cases where that just can't happen. Some countries that do this are Germany, Japan, and Netherlands. And then in a hybrid system, it's basically just going to be a mix of any of the insurance systems or the healthcare systems I already talked about. So, for example, Australia, France, Singapore, Sweden, and the UK all use hybrid systems of a mix of socialized, single payer, and insurance mandated healthcare.
So now Ashwin and I are going to transition to giving our own takes on what we think is the personal best healthcare system in terms of quality, affordability, and other factors that people really prioritize. So going into my take, I think that there are three things that should really be emphasized, which are the strong focus on research, which are finding new solutions for current and potential issues in public health. And then there's a strong focus on educating prospective medical professionals so that way they're able to demonstrate leadership, professionalism and accuracy in the quality of their work. And lastly, a focus on spreading medical professionals somewhat equally across all parts of the territory. And we're talking about the US, like across the entire US somewhat equally, because I feel like these three components really cover the idea of finding new solutions, having a system that really helps out the patient with the education portion. Like, for example, going into that, like, if someone isn't able to be a leader or able to communicate effectively with the patient, then the patient is confused and then the healthcare system is worse. And lastly, going into that last one of spreading people equally, I think this one is somewhat controversial because a lot of people like to go for more of those population dense areas, like keeping medical professionals in those areas. And that's kind of how it already has worked for the time being in many different countries. But I think that a problem is giving access to people that live in less urban areas or rural areas because these people don't have equal access to healthcare. And I think that's a huge problem when we go into cases you'll see that there are some people that live in these areas that aren't able to get the care that they need, and then unfortunately they face negative consequences because of that. Another part of my quote unquote perfect healthcare system is having a market-based system to keep the prices low and allow like the highest quality providers to do the best. Because if there's one big institution or if it's through the government, then the problem is that like the prices can really be high at some points of time in terms of prices of receiving healthcare for the patients. And as we've kind of gone through in our information, these prices have really been a problem for people and it needs to be kept low. And then uh, my last few parts of my perfect healthcare system is that Medicare pays for all travel costs and lower salaries for healthcare providers because what happens is a lot of people are incentivized to pursue healthcare because of the high salaries, and we want to discourage that and instead promote it because of people who want to be good humanitarians and really make a positive impact in the healthcare system instead. That's what we want to encourage inside of our healthcare system to be more efficient and a stronger system in general.
So while I understand that this is just a hypothetical, um, I'm not gonna nitpick, but what I am going to do is nitpick and ask questions. So the first thing that I at least thought of was for lowering salaries for healthcare providers. Sort of the last thing you brought up here. One thing you mentioned is that we should incentivize going into healthcare for humanitarian reasons, obviously, just like moral and ethical goodness, like being a good person, and that's why someone should focus on trying for healthcare. But what I ask then is, what if this backfires? Like, what if people just decide not to go into healthcare? Do you think that, like, this could sort of mess up the system where there aren't enough people in healthcare in order to, like, treat all the patients, and then we're left with sort of a system kind of like Canada's where we're waiting, like, a long time for some specific sort of case? Like, what do you think here?
So I see your point because, if you decrease the salary too much, what happens is many people decide to drift away from medicine and potentially pursue other careers. But I mean, your question kind of is a little bit difficult, but the thing is that I would say that we would decrease salaries to the point where it's still able to put food on the table and people are being able to buy adequate households. But I would say that it still would promote humanitarianism because there are other jobs out there that do pay more money. That's how I would set it up, at least that there are many more jobs that pay more money, but it still gives, positive results economically for the family of the doctor and themselves.
So, okay, so we had differing opinions on this, I guess, because sort of what I thought as soon as I asked myself, or as soon as I asked you that question, I thought of maybe something like employer benefits, is what I was thinking. So, essentially, if someone's doing it just for the humanitarian reasons, then they should be able to get some benefits that are acting as a failsafe in case the monetary value just doesn't come in. Because in that sort of scenario where someone's waiting for their healthcare or waiting to work, then that's just on the incentive. So if the incentive comes with benefits, not necessarily monetary value, like obviously it's monetary, let's not mince words here, but in, I guess, sort of masking that monetary value as a benefit, I feel like that could help boost the sort of humanitarian reasons because sure they're doing it to be a good person, but they're not going to immediately lose out on all the other benefits that they could normally have, is what I was thinking at least. Does that sound reasonable?
Yeah, that sounds good. I mean, I didn't really think about that to be honest, but that sounds good.
Okay. And then the other thing I wanted to touch on, strong focus on spreading medical professionals somewhat equally across all parts of the territory.
Yep, that was a
Um,
controversial one.
so obviously, I guess if we do use your sort of last like step here in the perfect healthcare system of lowering salaries, do you think that that would help, or hurt sort of spreading healthcare across like the whole territory? Because in my opinion, I guess I can go first here. When you spread people across a equal amount of territory and the incentive is somewhat lowered, then that could affect essentially if someone wants to work in a more rural area. Because if unless the pay is sort of equal, like unless there's equal benefits for all, then someone is obviously not going to work in a place where they might be treating one patient a day or something versus someone who has multiple meetings a day is still getting the same benefits as the rural person but is just overall being paid more. So I think generally it hurt. But that's just what I think. What do you think? Do you think it hurt or helped?
So yeah, I think it would hurt, but what I do propose to this is that we decrease the salaries proportional to the area that's being covered. Like for example, in rural areas, obviously it's just generally going to generate less revenue than like a place like that's very populated, population has a high population density. And so yeah, that's what I would suggest it suggest is decreasing those salaries proportional to the revenue that the healthcare system in that specific area generates.
Okay. That's I guess a good take on it. That sort of covers my nitpicking but not nitpicking on your universal healthcare system take. I think now I'm gonna go into my take on what the best universal healthcare system would be. Now, I took mine in a more literal approach. I sort of tried to model it based off of a real life scenario, but this is sort of what I was thinking. So, at the moment, the American healthcare system has free healthcare for low income people and the elderly, which is Medicaid and Medicare, respectively, while everyone else gets insurance through private employers or other ways, and they pay premiums and deductibles for healthcare needs. So essentially, if someone wants, I don't know, insulin, they need to pay a deductible in order to get that insulin, and then they can use it. Versus low income families or elderly people can get their insulin. Obviously, they might still have to pay a little bit, but it's going to obviously be less. So, one thing that I really liked from researching the healthcare systems around the globe, just like different ways that countries do it, was Canada's. Because Canada, what they do is they add a tax, essentially, and then they run specific cases where the government will pay for it. But the biggest problem in Canada's system is time. Canada can take a really long time in order to get appointments that you need, and even in those cases, sometimes it's not always going to be the best quality. Obviously, it's not going to be as expensive because it's coming out of your taxes, so it should be sort of in that way, but the quality shouldn't have to take that much of a hit. Now, America is spending over 20% of their money on healthcare already, as of 2019, I believe. So, my proposition is that if we keep spending that money, we could actually put it into shortening time for healthcare. So, essentially, adopting Canada's system, but using more money to, I guess, sort of taking bits from your take on the universal healthcare system, using that money and spreading professionals across all the territories, lowering their salaries so you're not using as much of that money, and providing good healthcare in a fast rate is sort of what I was thinking. So, I mean, basically it's Canada's system, but with a stricter tax payment. It's obviously going to be by bracket, and as much as we'd want it to be more for the rich, uh, let's be honest, with today's sort of tax system, it probably wouldn't be that way. So for the first few years of this system, we'd probably be dealing with problems of the rich not paying enough for healthcare and taxes, but that's just going to have to take time. And keeping Medicaid cheap for elderly and low income families will still be the same because now there's more generalized locations for their healthcare. And also making expensive deductibles and premiums sort of cut out. It cuts out the middleman entirely because now what you're doing is you're adopting a system that doesn't need those, but you're funneling in more money to help provide those types of products. So I guess sort of the biggest nitpick on my own system, if we wanted to get into it, is prescription drugs, which at the moment are typically paid for by insurance prescriptions, which are then covered a little bit, but are mainly paid out of pocket. So that's a huge issue that be needed to be dealt with. essentially. How are we going to deal with prescription drugs if we don't use deductibles and premiums? So that's a big issue. But other than that, I was thinking that this could be a really good healthcare system.
I
So,
disagree. I
okay.
think that there is another problem. This kind of screams tax the rich, and unfortunately, that's going to bring like a lot of problems with people complaining about that them being taxed. It's like a very democratic approach to
Yeah,
a healthcare
okay.
system,
So,
and
so,
not
uh,
everyone's going to agree with that. So, what do you have to say to that?
So, I mean, yeah, obviously this is a hypothetical here. That's probably going to be the biggest problem, sort of establishing the system with the rich obviously not they're not going to like a new heavy tax that can help benefit a lot of the population, let's be honest, they're rich people. But I'm just that's a joke. For all intents and purposes, it's a joke. But basically what I'm saying is if we were to get past that sort of phase of getting the rich to pay taxes on their healthcare, I feel like that's where the system could really come in handy. So, how we're going to get there would take time, would have problems. Is it worth it? I think yes. So, how would we do that? I honestly don't know enough about that in order to form a plan, but it'd probably have to be some sort of campaign. Uh, just trying to deal with that sort of, um, I guess, sort of problem.
Yeah, I can see you walking around with the sign saying tax the rich. Sounds good. Obviously, America's healthcare system isn't perfect, and there are many cases in which people are screwed over by America's systems. Now we're going to dive into one about a woman who faced type 1 diabetes. She faced this diabetes for most of her life, and she needed insulin to survive. But she struggled to afford the insulin that she needs. She even tried eating less in order to control her sugars, which affected her hunger. Her job provided medical insurance, but she needed to pay a high deductible in order to cover her insulin. However,
Her
she could
deductible ended up being about $1,000. Just so we're aware here. Her deductible to get this insulin, even after paying the insurance, was about 1,000. Keep going. Sorry.
She couldn't afford the deductible, however, so she couldn't end up receiving the insulin. And in February of 2020, her blood sugar spiked. And after being on her mother's health insurance, she started to receive free insulin as donations, but those started to run out as well. To this day, she runs on little insulin and doesn't know where she's going to get the remaining portion of her insulin after it runs out. So this kind of case shows a lot about the insulin shortage that people face who can't really necessarily afford it. And so, Ashton, I have a question for you. Why are prescription drugs priced so high, and in what ways can they be lowered so they can be more affordable and they can better provide for people?
So, one of the biggest reasons why prescription drugs can be so expensive are because of the lack of price regulation, the drug exclusivity protection, and the price hikes in the supply chain. So, starting off in the lack of price regulation, basically, drug manufacturers can basically just stamp on a price when it comes to how much American patients pay for their prescriptions. While the FDA, again, Food and Drug Administration, regulates how they're tested, marketed, and released, they don't have any control over the prices. Meanwhile, customers are subject to what is called big pharma, which is essentially just the payments for these prescription drugs. And in May 2019, the Trump administration finalized a new requirement for manufacturers to list the price of drugs in their advertisements, but they never actually made any changes to lowering those prices. And a 2013 study found that out of pocket costs with insurance exceeded the cash price of the drug without insurance 23% of the time. I mean, that's just crazy because no one should be paying that much, even with insurance, for a prescription drug that they need. In the case of drug exclusivity protection, this is when a drug hits the market and it is then immediately placed under a patent and a drug exclusivity protection, with patents lasting as long as 20 years. Drug exclusivity means that other pharmaceutical companies can't compete by developing generic drugs with similar effects. This could actually be really bad in turn with the first reason, because someone could have drug exclusivity protection, release their medicine under a really high price, not face much backlash because it's big pharma. The consumers can't really do much about it. It's placed under a patent and protection. And then it lasts for about 20 years. So someone who needs that medicine for their care can't receive that medicine under a good cost. This is something that can happen with the insulin, and it's crazy. It happens all the time. So this sort of gets into the next reason of the price hikes in the supply chain. So even with the um, prescription drugs being as expensive as they are, sorry, insurance companies are putting the squeeze on customers by increasing the premiums and deductibles in health plans that don't always cover the brand name drug. And there are pharmacy benefit managers who manage price negotiations with pharmacies, insurance companies, drug companies, and even your employers to come up with a list of approved drugs that will be covered under your plan. It's a really bad chain that can actually affect you in a pretty tough way. If you need a specific medicine, but it isn't covered by your insurance, you could be paying a, a lot of money. This woman's deductible for her insulin was about $1,000. So, I mean, obviously it's not going to be $1,000 for insulin over the counter or something. I don't even think that's how that works. But what I'm sort of getting at is with these sort of funnels of what drugs can be sold to you, you could literally be screwed over out of paying less just because of the insurance you're using. Because what that does is then inherently like I don't know provides a list of options that could all be really expensive essentially, and then you're paying a lot more than someone else just because of your insurance, which can be really bad. Anyway, moving on, I guess to the second part of that question. I kind of rambled. In what ways can they be lowered to better provide? So obviously, I think the biggest thing, probably in my opinion, is get some sort of administration that can regulate the prices for these drugs. Right now, it's just the drug manufacturers that can call the shots to how much a prescription is worth. So if we had some sort of administration, sort of maybe balancing out the drug's usefulness, um, maybe like rating, side effects, and put a cost on it, it could possibly be a fairer cost, and then consumers would pay less. Big pharma would be replaced with I don't know, big administration. It's like I don't know, we could probably be saving a couple $100 here and there each time someone gets a new prescription, because it's not just on the manufacturer that created it who's trying to make money. It's on the administration who's regulating the fairness of it. Does that make sense?
Yeah, that makes sense to me.
Okay, and then sort of with the drug exclusivity protection by I think decreasing the amount of years it's covered under a patent, maybe from 20 to 15. Start with a small change because right now, if the administration places an unfair price or the medicine ends up turning out to be different than what was tested, someone could be looking at uh, paying a lot of money for a long amount of time. I think obviously this isn't as big of an issue because, again, while these patents can last a long time, it could also be up to just over the counter drugs that can cost a lot just generally, whereas something else could have a similar side effect. So, Saj, I did sort of ramble, but what do you think about my whole spiel there in lowering prices in order to better provide?
Yeah, I mean, you covered a lot of different things and ways, specifically like through organizations that can help reduce, or like systems at least. I know you briefly covered that, but that can help reduce drug prices. But I think that what another huge problem of why prescription drugs cost so much is monopolies that kind of dominate the markets, and that causes other people to have to increase their prices too. I actually think you mentioned that, but I'm not quite sure. But yeah, I mean, like balancing the power, I guess, is another thing that we would have to do so that way one monopoly doesn't dominate essentially the entire market of drugs. So next on to what groups of people should insulin be free for, if any? And I think that this is a question on like how the economics should work, stockpiling versus providing to functionary members who can actually pay. And I know I kind of attacked you, Ashwin, earlier for taxing the rich, or like making the rich pay. But I do think that we should, you know, make insulin free for those members of society who live in rural areas or have low income that might not be able to, pay for their insulin for their diabetes, because diabetes is growing every year, and low income areas, that the number of people that are going to need those prices free in these low income areas are going to increase as well, with more diabetes occurring. So I think we should make it free for these people in low income areas that have diabetes and that need that insulin to help them out. And now for our next case, this is a little bit more of a quote or like sharing of their opinion on Medicare, but it's certainly a lot different than the feelings that the last person invoked. So now I'll get to it. Quote, Medicare is a blessing. Don't decrease these benefits which are granted to all citizens in civilized nations today. Medicare covers 80%. With the increasing medical fees today, even the average person is finding it difficult to come up with 20% of the cost. Many of these illnesses are a result of former administration's lack of refusal to control our environment from contaminants. Therefore, I feel like the USA should pick up a higher medical tab. End quote. So, Ashwin, what are your thoughts on this quote? I mean, at the beginning, it talks about how Medicare is a blessing, but then the person talks about how people struggle to pay. So, do you think that Medicare is a blessing, and what do you think are the best parts of the United States' current healthcare system?
So, in my opinion, the best part about the United States current healthcare system is that we do actually have services in place to sort of tax the rich, use that money to help other people in their, I guess, sort of to help provide for other people. And this is certainly a good step in the right direction. I feel like, sort of going back to my perfect universal healthcare system, I think it'd be really important if we could try to get more money from them, which, I mean, if we're being realistic, probably won't happen. But just saying, if I were to sort of take the best part of the United States healthcare system and sort of uh, think of my own way to improve on it even more, I'd focus on trying to find a way to use that money in order to try to eliminate insurance costs altogether. Because again, I think cutting out the middleman, sort of going away from an insurance-based healthcare system, would be our best bet. Obviously, insurance is going to be a big part of healthcare for the next, for I don't know, a long time, unless the healthcare system switches in a long time in America, but we should still be focusing on trying to make the tax brackets for these certain, I guess, sort of, for these certain services a lot more fair so that we can get to a point of universal healthcare with this already best part of the United States current healthcare system.
Yeah, I mean, we did kind of criticize the current United States healthcare system a lot, and you did a pretty good job just now of like answering what parts are kind of acceptable at least. So yeah, I think I kind of agree for the most part.
And that was our last case, so that's actually our sixth episode. Thank you guys so much for listening to the Medicopolis podcast. We hope you all stay tuned for next week's episode and as well as what is to come in the future.